What is the primary reason for using ECMO in patients with refractory hypoxemia? A. To increase blood pressure. B. To provide cardiac support in cases of myocardial infarction. C. To enable the lungs to heal by taking over gas exchange. D. To replace the function of the heart in cases of circulatory collapse. Answer: C. To enable the lungs to heal by taking over gas exchange. Explanation: ECMO is used in patients with refractory hypoxemia to provide temporary support when the lungs are unable to oxygenate the blood adequately. It allows for gas exchange to occur in the ECMO circuit, giving the lungs time to recover from the underlying disease or injury. What is a potential complication associated with prolonged ECMO support? A. Spontaneous improvement in organ function. B. Infection from the cannulation site or ECMO circuit. C. Decreased oxygenation due to malfunction of the oxygenator. D. Increased cardiac output beyond the patient's baseline. Answer: B. Infection from the cannulation site or ECMO circuit. Explanation: A potential complication associated with prolonged ECMO support is infection. The cannulation sites and the ECMO circuit itself can be sources of infection, which can lead to systemic sepsis, prolonged ICU stays, and complications in the patient's recovery. Strict aseptic techniques and close monitoring are necessary to minimize this risk. When considering ECMO as a treatment option, what is an important factor in assessing the patient's prognosis? A. The patient's body mass index, BMI. B. The underlying disease's reversibility. C. The patient's level of consciousness. D. The patient's age only. Answer: B. The underlying disease's reversibility. Explanation: The success of ECMO depends on the underlying condition's potential for recovery. If the cause of cardiac or respiratory failure is reversible, ECMO has a higher likelihood of success. In contrast, ECMO is less effective in patients with irreversible organ failure or conditions with poor prognosis. What is a key disadvantage of using ECMO for prolonged periods? A. Decreased lung compliance. B. Increased risk of bleeding due to anticoagulation. C. Reduced mechanical ventilation requirement. D. Excessive fluid retention. Answer: B. Increased risk of bleeding due to anticoagulation. Explanation: One of the key disadvantages of prolonged ECMO use is the increased risk of bleeding due to the anticoagulation therapy required to prevent clotting in the ECMO circuit. This can lead to hemorrhagic complications, particularly in the brain, gastrointestinal tract, and cannulation sites. Which of the following is a common method used to monitor the effectiveness of ECMO in improving oxygenation? A. Blood gas analysis. B. Chest X-ray. C. Cardiac output measurements. D. Electrocardiogram (ECG). Answer: A. Blood gas analysis. Explanation: Blood gas analysis is commonly used to monitor the effectiveness of ECMO in improving oxygenation and carbon dioxide removal. It provides real-time data on arterial blood gases, ABG, which helps to assess how well the ECMO circuit is oxygenating the blood and removing carbon dioxide. What is the purpose of placing an oxygenator in an ECMO circuit? A. To increase systemic blood pressure. B. To remove carbon dioxide from the blood. C. To prevent blood clotting. D. To monitor the patient's blood volume. Answer: B. To remove carbon dioxide from the blood. Explanation: The primary purpose of the oxygenator in an ECMO circuit is to remove carbon dioxide from the blood and to oxygenate the blood, mimicking the functions of the lungs. This allows patients with respiratory failure to receive oxygenated blood while providing time for the lungs to recover. Which of the following is a key factor in determining the appropriate cannulation strategy for ECMO? A. The patient's respiratory rate. B. The underlying disease and organ failure. C. The level of consciousness of the patient. D. The size of the ECMO circuit. Answer: B. The underlying disease and organ failure. Explanation: The choice of cannulation strategy is largely influenced by the patient's underlying disease and organ failure. For example, venovenous, VV. ECMO is used for respiratory failure, while veno-arterial, VA, ECMO is used when both the heart and lungs require support. The cannulation strategy should align with the primary organ system failure. Which of the following complications can result from improper cannulation during ECMO? A. Hemolysis. B. Hyperglycemia. C. Tissue ischemia or injury. D. Hypertension. Answer: C. Tissue ischemia or injury. Explanation: improper cannulation during ECMO, such as placement of the cannula in the wrong vessel or using incorrect cannula sizes, can result in tissue ischemia or injury due to impaired blood flow or mechanical damage to blood vessels. It's essential to ensure that cannulation is performed correctly to avoid these complications. What does the term bypass in ECMO refer to? A. Bypassing mechanical ventilation to promote lung recovery. B. Bypassing the heart and/or lungs to allow recovery of these organs. C. Bypassing blood pressure support to prevent shock. D. Bypassing medication use to reduce side effects. Answer: B. Bypassing the heart and/or lungs to allow recovery of these organs. Explanation: bypass in ECMO refers to the process where the ECMO circuit temporarily takes over the function of the heart and/or lungs, allowing these organs to rest and recover. This is typically used in patients who have severe, life-threatening cardiac or respiratory failure that cannot be managed with conventional therapies. Which of the following is a disadvantage of using veno-venous (VV) ECMO in patients with severe pulmonary failure? A. It provides no cardiac support. B. It increases the workload on the heart. C. It increases the risk of systemic embolism. D. It is only effective for short-term use. Answer: A. It provides no cardiac support. Explanation: veno-venous (VV) ECMO is used to provide respiratory support in patients with severe pulmonary failure but provides no cardiac support. In cases where the heart is also failing, veno-arterial (VA) ECMO would be more appropriate, as it supports both heart and lung function.